Hi guys, this is Dr. Nida with Keys of Health. This is one of the most comprehensive videos you will probably ever see on uterine fibroids, so I encourage you to bear with me and watch till the very end. Before we delve into the topic, I want to give you the good news that fibroids are treatable. I had a 58-year-old postmenopausal lady reach out to me a few months ago. Doctors had found a whole bunch of fibroids in her. She was diabetic and had other health conditions as well. We discussed a plan for her, and guess what? When she went back for her follow-up after 3 months, there were no more fibroids. They were gone. If it is possible in the case of a 58-year-old severely diabetic woman, then it is possible for everyone. So let's start by talking about what fibroids are and what can be done about them. Fibroids are tumors in the uterus. They're mostly benign. They all start in the wall of the uterus and can grow one of two directions. They can grow to the outside, where they cause a lump, or they can grow to the inside and disrupt the lining, which women slough every month. So they all start in one place and then go in either one of the two directions. If they are on the outside, they're mostly just a nuisance. It makes the uterus large and lumpy and irregular. If we look at the US, about 18% of Caucasian women have fibroids, but it can be as high as 30% in African American women. Why is that? I want you to keep this point in mind, and I will give you the reason for it when I talk about remedies. Now, 80% of uterine fibroids do not necessarily cause health problems. They don't cause bleeding or pain or anything like that. They just hang out on the uterus. They usually picked up during a medical exam, an ultrasound, or during a C-section. Most of these fibroids don't seem to affect pregnancies. I do want to point out that if you have had a medical and your doctor detected fibroids, it is very important to get a follow-up ultrasound after 3 months and no later than that, because fibroids that are cancerous grow very fast. But relax. Cancerous fibroids are rare. There's only 1 in 2,500 chance, or like 1 in every 2,500 cases, there's a chance of that happening. So really, there's no need to stress. Just keep a very close eye on it and follow the advices I will share with you in this video. Now, there are some symptoms that you have fibroids and they're growing in size or multiplying in numbers, so it's a good idea to keep an eye out for them. First and most important one is bleeding. What kind of bleeding? Periods that are getting heavier, prolonged bleeding, bleeding in between your periods, bleeding after intercourse, just abnormal, unusual bleeding, pretty much bleeding all the time. So what causes this bleeding? Remember, when I mentioned fibroids grow in two directions. If the fibroid is grown towards the uterus lining, which you slough every month, the uterus would normally grow a new lining. Think of it like a room you're in. If you have wallpaper all over your walls, you remove that wallpaper every month and put in a new one. If you have a large brick or a rock or something protruding from the wall, that wallpaper won't stick and would fall off. That's exactly what that fibroid is doing. So basically, fibroids become problematic when they begin to erode into the lining of the uterus wall. The second symptom is pain. It is uncommon, but it happens. That's usually when the fibroids have really grown and are heavy. So if you have abnormal bleeding or you feel heaviness or some sort of abnormal growth between your belly button and your pelvic bone, it is time to see a gynecologist. Now, fibroids usually don't come alone. You will find an entire family in there. So if you find one fibroid, there is a good chance there are a few more hanging out there. So there is absolutely no need to panic. You can treat the fibroids and they can go away. Of course, every case will be different depending on the size of the fibroids and the amount of them. But by doing the right things, even if you don't get rid of your fibroids, you can significantly improve your quality of life and reduce or eliminate the bleeding and pain. Remember, when I mentioned that African American women have higher risk of developing fibroids than Caucasian women? Well, there is a reason for that, and that reason is estrogen. African American women have higher estrogen levels than Caucasian women, and high estrogen levels can cause fibroids. So here is the million-dollar question. What to do about these fibroids? Fibroids are tumors. What makes the tumors grow? Anabolic hormones. In this case, these are androgen, insulin, cortisol, and estrogen. Cortisol is related to stress, so high stress levels increase your cortisol levels, which can cause fibroids to grow. Estrogen, of course, you get it through your food or even from your fat. So if you have high fat content, your body can turn androgen into estrogen. And what triggers insulin production? Refined carbs, of course, and insulin will in turn increase your androgen levels. So you see how they are all interrelated. Now, it might seem overwhelming and difficult to figure out where to start, and I will help you with that. You see, the idea is simple. Remove what is causing the problem, give the body what it needs to heal itself, and you will take care of the problem. So let's start with what we need to remove from our lifestyle and from our diet. First, estrogen. You want to remove estrogen-rich foods from your diet. These include soy products like tofu and soy milk, dried fruits, flax seeds, sesame seeds, and some nuts. Smoking can also be problematic for fibroids because of the chemicals in the smoke. These synthetic chemicals are endocrine disruptors and mimic estrogen. Other endocrine disruptors include pesticides, fungicides, herbicides, BPA from plastics and other substances. All these interfere with the normal function of your body's endocrine system, so leading a chemical-free lifestyle as much as possible goes a long way. You also want to stay off of dairy. This includes milk, cheese, yogurt, ice cream, basically all things dairy. And you want to eliminate all sugar and refined carbs from your diet, at least for 3 to 4 months entirely. And even after that, you want to keep it to a minimum. This means no soft drinks, bottled juices, candies, cookies, cakes, all that good stuff. I know it sounds overwhelming, but take it one day at a time. Don't think about 3 or 4 months. Think today. Make a 1-week plan and then continue that. Habits are changeable. We are constantly developing new habits, and the same is true for food. So don't let it overwhelm you. I would also recommend removing wheat from your diet at least for the first month entirely. If you must eat grains, switch to brown rice and ancient grains like quinoa and amaranth, but stay off of wheat. And you must lower your stress levels. Like I mentioned earlier, high stress levels will increase your cortisol levels, which cause fibroids to grow. And you must control insulin resistance in the body. I will tell you how you can do that when we talk about what you should do. Now, these were all the things that you should not do. Now, let's talk about things you should do. It all starts with your diet. You are what you eat. You must include cruciferous vegetables in your diet. Vegetables like kale, cauliflower, cabbage, bok choy are all extremely important for you. So you should be eating them daily. Now here's where you really want to pay attention. There is a mineral which is great for women and especially great for estrogen-dominant women, iodine. Iodine helps lower estrogen levels. It is difficult to get iodine through the diet, especially in the US, because our soils are depleted of these trace minerals. Unless you eat a lot of seafood, and especially seaweed, there is a good chance you're deficient in iodine. Sea kelp is a great way to incorporate iodine in your diet. It's not that difficult to incorporate once you get used to it. So I would highly recommend getting sea kelp from a good, pristine, clear water source. Now, due to excessive bleeding, women with fibroids tend to become anemic. When this excessive bleeding stops, the anemia will be taken care of. But I will give you some ways you can take care of your anemia while you're following the plan to address fibroids in your body. Red meat, of course, is great. Go for grass-fed, organic, free-range meat because you don't want to put any additional hormones that commercially produced meats contain. Seafood is great for both iodine and iron, so this is a must for you. And dark leafy green vegetables such as spinach. So you want to incorporate these in your diet as much as possible. You also want to increase your vitamin D levels. Vitamin D helps regulate insulin levels in the body. You want to get it both from food and from sun exposure. Along with that, you must have a healthy, well-balanced diet. Include plenty of anti-inflammatory foods in your diet. Quit smoking and drinking. Lead an active lifestyle, walk at least 30 minutes daily, and make sure to manage your stress levels. If you follow this plan just for 3 months, you will see a significant difference in the amount of bleeding, the pain, your energy levels, and there's a good chance that some of your fibroids will be gone after this initial plan. I wish you all the best. I know you can do it. And once you feel what it does to your body and how great you feel, you will never want to go back and will be motivated to continue with the plan. So thank you for watching. Please don't forget to subscribe and share this video with your friends and family. Take care for now. Goodbye.